Okay, so thank you so much for the nice introduction, David. Now I'm quickly going to introduce the panelists, and then, then let's get going, right? Yeah. Okay, so we have you've seen some of these panel us giving talks already. Others will only give the talk tomorrow. So we have Dr. Anya Ermakova. She's at Berkeley PsychTech and that collaborates with King's College London. And I just do it always very briefly because there we go. Highly relevant for today is that she is doing she's a clinical research consultant mapping the highly topical 5-MeO DMT experience with so-called microphenomenology. And the good thing is she does qualitative work, which means she really, captures people also in their own words, I guess. And so this is quite a contrast to quantitative research, for example, from the last talk that we just saw before. So really try to listen to what people have to say and learn about that like this. And so, yeah. Then there is Dr. Helena Aicher. Postdoc researcher and psychotherapist, both working in a private practice, also at the Psychiatric University Hospital in Zurich, and also affiliated to the University Basel. And she's also done clinical trials in her research arm of work with ayahuasca, analogues, and also 5-MeO DMT. Great. So you see, we have lots of people from the field, so we can really talk about this experience with people that know and have had experience about this. And then we also have Dr. Laura Pustarfi. So again, back on stage, just a bit more to the left now. Huh? She's director of the certificate program at the California Institute of Integral Studies. And yeah, if you have heard her today, her focus is very much also on plants and fungi, and especially also the ones that have psychedelic properties, I guess. And we will also talk about connection quite a bit maybe today. And so, for example, connection to nature, to plants. It's a very interesting aspect of the mystical experience. Right. And so, Dr. Michiel van Elk, are you already back after all that talking before? Great. Just been introduced before, but in case you just joined us, assistant professor at Leiden University in the Netherlands, heads this lab with the very interesting name, right? Psychedelics, Religious, Spiritual, and Mystical Experiences Lab. As you might have, if you have been here before already, is doing very rigorous research, applies field research, phenomenology, psychophysical tools, and also neuroimaging. Okay, so without further ado, let's just see that I was told that there's a time there. Then yeah, I see it. I just checked now, so we have a bit of the control. I was first asked to give you a quick introduction. So for this, I quickly go more like this. Quick introduction, about 5 minutes, into the mystical experience. So what I like about one of the scholars, philosophical. Oh, I need some water too.
Do you like water?
Yeah. Or just anything. Yeah.
There you go.
Walter Stace was a philosopher that looked at the mystical experience, and he said one of the most unfortunate things about the mystical experience is its name. You know, mystical, so you kind of think, oh, it's misty, it's foggy, can't really grasp it. But I think if I was just to be allowed to just use one sentence to describe the mystical experience, I would say this. It usually involves the transcendence of the subject-object dichotomy. And now you go like, well, what does that mean? So, but the idea, that if we just take normal, everyday consciousness for a minute, ordinary consciousness, the idea that we have to dichotomize things into subject and object is there all the time, right? Because it's, for example, whenever we think in language, there is a subject, there is an object. So even if I say a very connecting sentence like, I love you, the I is the subject and the you is the object. So, and that runs through our minds all day long, because even if we don't speak, if you ever watch yourself, if you're not speaking but thinking, much of our thought is also verbal. So the idea is that if you get into a non-ordinary state of consciousness, and especially sometimes quite strongly with a psychedelic, that this kind of transcendence between I and you, or me and the world, or for example, me, I'm sitting here now, you're over there, that kind of goes away, is transcendent. You get in a deep sort of sense of oneness. You still see that there is diversity, but you feel this is more sort of at the sort of more superficial level, and you kind of have the subjective impression, whatever that means, that basically everything is one, everything is connected. So it's kind of an amazing change from everyday thought, where whenever we use language, we always have to dichotomize things into subject-object in any language in the world. So all of a sudden to be taken out of this is quite interesting, all by itself. And it also goes that it's often sort of goes along with feelings of bliss. Sometimes people give it a religious, spiritual interpretation, but there's also atheists that have mystical experiences. And there was a lot, I think, already in the introduction. One way we look at this is going to discuss is how we measure this thing. And we see there's quite a bit of conflation between the actual core experience, which is just this oneness, this transcendence of the subject-object dichotomy, and other things like bliss, and if you think this has a spiritual meaning or not. And so how do we measure it? So far, usually it's the way it's measured, it's with questionnaires. There's two main questionnaires called the Mystical Experience Questionnaire, and the other is the Mysticism Scale. They're both validated. But so how did these questionnaires develop? If you look at it, there were two important scholars in the 20th century that kind of summarized lots of thought about mystical experience. One of them was Rudolf Otto, and the other one was Walter Stace. And Walter Stace in the 60s, what he did is he took 2 or 3 years of reading. He went through sources of like classical paganism, Christian mysticism, especially Meister Eckhart, even Islamic Sufism, Hasidic Judaism, and even one single case, Vescaline case study. And he tried to sort of come up with what is the essence of the mystical experience. And it's basically, in his 1960 book, there's a 3-page summary of all of this. And these two modern ways how we measure the questionnaire is basically just this 3-page summary is translated into questionnaires. And that's pretty much it. You don't see anything else actually much than more in this summary, which means mystical experience, the way it's measured in psychedelic science, is the way it has been covered by Stace, basically. Which, maybe he forgot things, maybe he left things out, maybe people have other opinions. That's not really something that we can measure right now. Yeah, and so, although we might be critical about the associations with beneficial aspects, especially after your talk today, but some studies have shown correlations with, for example, for healthy people with improved effects on attitudes, mood, behavior, and also we see some reductions in anxiety, depression, addiction, which makes it interesting at least to look at. Yeah, I think that was pretty much this introduction. Now let's open up the panel. So I always thought we could maybe sometimes also use a few quotes from people, what they actually experienced. And so I need a bit of paper here. maybe just give you a quick overview to see how far we get. My idea was that we first look at the sort of the essence of the mystical experience, then also look at maybe things that might be part of mystical experience but are not covered because they have been forgotten by stays. And then we already had some discussions via email. We'd like to distinguish between phenomenology and interpretation. Phenomenology just means we will see that whatever you perceive, and interpretation is once you put some meaning to it or think it's spiritual and so on. We're going to look at some differences between substances, and also sometimes there was a bit of too much of a focus maybe in the research on the mystical part, which means you transcend, yourself of sense is transcended, but there's also lots of interesting psychedelic experiences, autobiographical ones, age regressions into childhood and so on. So we go look also a bit into this. Yeah. So I thought I'd start off with what I consider the core of the mystical experience and just read out a quote and excuse me, and just see what you think of it. This is a quote from back in the 60s where somebody received a high dose of LSD. And then he said, I could feel my body dissolving and actually becoming a part of the goodness and peace that was all around me. You see, sort of, his body's dissolving, he's not so much himself anymore, but he's connecting, right? He feels with a sense of goodness and peace all around him, all of a sudden, that was not there before. Shall we each? So my basic question is, so what do you think about this basic core idea of the transcendence of the subject-object dichotomy? Maybe just go over.
Well, the first thing that comes to mind for me is also this transcendence. It's not necessarily a dichotomy, it can be gradual. So, for example, the sense of self is not a unified construct. You can have bodily self, you can have narrative self, and looking at the people's experiences more closely, you can see that sometimes the bodily self dissolves, but there is still perception of yourself as a person with certain name, certain life history, and then you can have different parts can dissolve. You can lose the memories, you can lose idea of who you are, you can lose the idea that you're human, up until there is something that remains. But yeah, it's not a unified construct, a sense of self.
Mm-hmm. Yeah, I agree. When you wrote this quote, I thought of two patients, and which both would kind of fit into that quote, and like in situations, and one certainly had a maybe more stereotypical, full-blown mystical body and self-dissolution, and in that sense became maybe one with the surrounding. But there was this very touching moment for me in a psychedelic therapy session towards the end, where I would sit next to a patient who had been there for a year, so we knew each other for some time, and we sat outside in the garden after the session, and he said, the more I do this therapy, the less it is different to my everyday life. So it was very subtle and very non-spectacular, but at peace with whatever there was at that moment. Yeah. And I think it doesn't qualify in the sense of ego dissolution in a like fantastic meaning, but for me that was kind of touching the really essence of that. Yeah, maybe counterintuitive.
Yeah.
Thank you. I appreciate this quote that you've started us off with. And in terms of the transcendence aspect, there's a sense, especially in religious studies, of going beyond and connecting with something beyond, with the divine and the mystical experience. And what I like about this quote is that it's connecting with the good, and kind of a different way of bringing that in and connecting more broadly in that dissolution of the subject and object in this particular quote. And I think that it's important to have those broader aspects of spirituality or the mystical experience to include a variety of that type of experience as well.
Mm-hmm. Yeah,
thank you.
Michiel?
Yeah, my concern with the definition, as you started out with, the transcendence of the subject-object distinction, is that the definition could also be labeled differently. So it also reminds me of a non-dual awareness experience, where people also report a dissolution of the distinction between self and other. Or David Yaden has called those experiences self-transcendent experiences, where you basically transcend the boundaries of the self, feel connected, and you experience self-loss. So a loss of the self where you become one with the environment. Mm-hmm. So my concern is that there are all these words in the scientific literature that are often used very imprecisely. Mystical experiences, non-dual awareness, ego dissolution, self-transcendent experiences, and we need more precise terminology to actually know what we are talking about.
Mm-hmm. Okay, so you think we still should find more precise language? Yeah. Okay. Yeah, and one tricky thing is just as a side remark, we said maybe some part of it dissolves of the self, part of it not. It's sort of a basic hallmark, I think, that it's always, whatever you describe in these experiences, it's kind of paradoxical in the sense of that even, I'm not sure it's been mentioned, but I've also done lots of interviews with healthy participants, maybe 200 or so myself. And whenever they describe this kind of unity, it's usually paradoxical because in a way they feel one with everything, but at the same time they also observe themselves. So in a way, if you just think of your mind's eye, so when you always have a mental viewpoint on something, so their ego can dissolve or whatever, but there still seems to be an intact kind of observer all the way through, which people are often embarrassed because they run into paradoxical language. So we need more preciseness, but it's a long, hard road, I think. Yeah, so maybe as a next thing, because for me it's always a bit strange that, the questioners have basically copied 3 pages of stays, and so this cannot be the end of the story. Maybe there is more to mystical experience. And what we even find in the lab at the University Hospital in Basel, where I also work as a research associate, where this is definitely not a religious kind of setting. It's a hospital, typical hospital Swiss room with a white wall and even a clock on the wall, and that's pretty much it. But we also can measure this. We find this quite frequently, the thing that I'm going to read now. I'm going to read out first a quote from meditation-induced non-ordinary consciousness, and then also a quick quote from a psychedelic experience. And the point is that many mystics think this is really a part of the mystical experience, and we are not covering it so far. So here we go. The first quote is from Edward Ermakova. Nobody usually knows him, but he was a great sinologist back in the 1940s, and he was one of the first to bring meditation to the West. So he went to China and did 6 hours of meditation every day, and then he got deeply into non-ordinary states of consciousness. And so here he says, the primordial ground, the Tao, appears as a unification of all corals, an indescribable white light, as it also recurs in the visions of the Occidental mystics and indicates that the goal of the immersion, the inner union with the world ground, has been reached. And for example, Walter Pahnke, the late Walter Pahnke, which was a pioneer psychedelic research in the 60s, in his experience by LSD, he said, the most impressive and intense part of this experience was the white light, and he put it all in capitals, of absolute purity and cleanness. And he kind of nicely also then distinguished this with what's associated with it. The associated feelings were those of absolute awe, reverence, and sacredness. So, and you know this white light, so it is it's kind of a brilliant white light. It's not just a little light bulbish light that seems to diffuse everything. And we also often find this, for example, in near-death experiences. And many mystical scholars or mystics have said this is part of the mystical experience. And why don't we measure it? Because it was not, Stace has forgotten about it. So my idea would be, can you think of anything that you might think belongs to the mystical experiences, but we simply are not covering it yet?
So first of all, I wanted to add something about the white light. So I study 5-MeO-DMT experiences, and very often when people describe some of the more intense experiences that they had, they very often involve this white light, and how either they dissolve in the white light or everything becomes the white light.
Everything becomes the white light. So
yes.
also kind of the mystical, stylish white.
Very, 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 very similar to this quote. It's actually quite remarkably similar. Yeah. And that also brings me to the idea how interesting would it be to compare phenomenology of mystical experience, naturally occurring, and drug-induced, and what differences would we see and what similarities.
But by naturally occurring, you mean?
I mean, like spontaneously occurring.
Spontaneously, yeah.
Yeah. Yeah. Not drug-induced.
Yeah.
Or induced by meditation practice or other practices, but without chemical assistance. But answering your question, what is it that is not included in mystical experience, it's quite difficult to say, because if we think about the definition of mystical experience, we go by Stace's definition. This is what mystical experience is. So what do we do? Where do we find the features of the experience that we are missing? And one of the ways of doing it would be to do qualitative interviews with people who have mystical experiences through meditation and other things that I mentioned earlier, and to look at the features of the experience that come up for them and see qualitatively, microphenomenologically, what are the details that were not part of Stace's definition.
Yeah.
Yeah, I mean, it's a difficult and interesting methodological question. When you think of, for example, intelligence research, we have this saying that intelligence is what you measure with the IQ test. And isn't it a little bit similar with the idea of conceptualizing a mystical experience? So what we can do, I mean, I agree, we can ask the people how they experience it, and we will maybe find some similarities, but also a huge variety. And then what we try with quantitative measures is to tackle these similarities and nail it down, but it's also how we operationalize something. So it's depending on what we define. And there we are again with what you said. So is it self-transcendence, mystical? So it depends. I think what we should do when we write about it is to explicitly state what we understand or how we conceptualize it. I mean, some terms are used in different ways, in different, for example, disciplines, and that's okay, but we need to kind of at least try to state what we mean.
Yeah. Maybe I can already throw in the next question. We mix these two questions a bit, because what I like about this, when he says about the white light, then he says the associated feelings were those of absolute awe, reference, and sacredness. So in a way, but many scholars, when they speak about this unity, that everything becomes one, they mention the light very much with that. So maybe we could also already start to try to distinguish. So could that help if we started to distinguish between phenomenology and interpretation? Because here we clearly, the last part, the associated feelings were those of, for example, sacredness, is clearly an interpretation. And he really distinguishes that from the other part. And the other part he seems to be saying, many seem to be saying that's part of the unity itself, basically,
Yeah, it's just difficult to measure something or to talk about something that can't put into words. So the most honest response I got on a questionnaire was like a visual analog scale from 0 to 100, and they were supposed to do a vertical line, and one participant just made a horizontal line. And I think that expressed quite nicely her state.
Yeah, okay.
Yeah.
Any more thoughts? Yeah.
Yeah. Well, I've been thinking with this conversation and topic coming up, this topic brings up more questions for me than answers.
Yeah, that's the idea.
And one thing with both of those quotes, and then also just thinking about mystical experience in general, I think one thing that may not be as in the conversation is this concept of sublimity, kind of the sublime from romantic philosophy, of both the awe and the sacredness, but also the fear and the challenging aspect of the mysticism, and also appreciate your comment about language, and you mentioned it too, about this ineffability in mysticism, and how do we really define terms for something that is inarticulable in certain ways, or can it be articulated? So more questions than answers.
Yeah. Okay.
Yeah, a couple of thoughts. Ralph Hood, who defended the M scale, the mysticism scale, originally in the 1970s, has recently developed a light scale because he frequently encountered that people reporting mystical experiences talk about the light that was not covered by his M scale. So that resonates with your observation. Mm-hmm. But at the same time, it really annoys me that it is capitalized in those reports, or also in the scale, so the white light with capitalized letters. And the same with the MEQ, where people talk about ultimate reality. So have you met ultimate reality in your experience with capitalized ultimate reality? Yeah. As if it is something beyond. And that is, I think, speaking to the issue of conflating metaphysical beliefs with experiences. Mm-hmm. Because it's capturing people's idea or notion or belief that they find out what reality is. Mm-hmm. And I think this goes back already to the development of the concept of mystical experiences by Walter Stace. Yeah. So we take his definition often for granted, and we talk about those criteria. But he had an agenda. He had a perennialist agenda, very much inspired by thinkers like Aldous Huxley and others who came to the idea that those experiences were at the basis of all grand religious movements, and that there might be a core experience underlying the wide diversity of mystics across cultures. Mm-hmm. But that is an assumption that was guiding his research that is not backed up by the actual science or the actual reports in different religious traditions. Mm-hmm. So I think it's really important to question whether this concept of mystical experience does actually make sense. It is a scientific concept. If I talk to lay people, did you ever have a mystical experience? They say, what are you talking about? What is a mystical experience? And everyone has a slightly different interpretation or association, but many people think about a meditation guru with a beard sitting on a rock somewhere, if you talk about mystics. But that already shows it's a scientific concept, but even as a scientific concept, it has an illegitimate basis, I would say. So I would question whether we need to add characteristics. I would more question, is it referring to a coherent cluster of characteristics at all? Mm-hmm.
What would you question? What was the last thing? What would you question at the last sentence?
So the last, so Stace has this different list of criteria, but if you look at how he put those criteria together, you can question if that is actually referring to a coherent concept at all, or if you need to study, for instance, people who lose their perception of space and time, or people who have a light experience, who see a light, or people who feel unity. Those are concrete characteristics or phenomenological characteristics that you can study. But if those joint characteristics refer to something that we label a mystical experience, I find questionable.
Yeah, yeah. But Stace also made the point that for him, there were just only the unity was the core experience that is somehow, as I said before, the subject-object dichotomy. He didn't use those words, it's transcendent, that everything feels one. And he clearly said that all the others, like ineffability, he also said that's only the periphery, because for him, we all know ineffability doesn't need to be a mystical experience, can occur in relation to something else. So I think for us researchers, it is important to try to think of what belongs to the core and what can we measure maybe also separately. And yeah, maybe I was going to ask you, Anya, a little bit more about, because when we try to tease apart, what people really experience and what is more of the interpretation, and used other words like meaning making and judgment. And so could you maybe tell us a tiny bit how your microphenomenology approach can help us here?
Absolutely. And it very much ties what, Michiel, you were saying about deconstructing these concepts of mystical experience or insight or experience of all those things can be deconstructed into smaller features, and I think we can study those features separately. And tomorrow in my presentation I show you what I've done with my analysis, where what I was asking, and particular method of qualitative interviews that I use is called microphenomenological interviews, and it goes into fine details of the experience. So rather than asking people what they think the experience was, or can they compare it to previous altered state experiences, or what do they think this experience means to them, what I'm going through this with my interview is what happened in the experience and how they experienced it at different sensory modalities, different emotions, and all sorts of parts of the experience. And there you can see in a very fine detail, and the longer the interview, of course, the finer details you can get, also the temporal unfolding of the experience. And this is what is completely missing in most quantitative studies, is how experience changes over time. So even if we think of mystical experiences by Stacy's definition, where it's usually involves positive affect and this feeling of peace and blissfulness, in real life that's not how it happens. A lot of times experience is dynamic, and it starts maybe with a bit of anxiety, a bit of fear, resistance, struggling to let go, and then people manage to let go, and then their emotions change. And it is really important to look also the dynamic unfolding of the experience. But yeah, coming back to your question about separating meaning making and judgment and comparisons of the experience, during the interview I specifically gently redirect people if they start making meaning of the experience or start to relate it to their previous experiences, and just focus on the details of what happened in the experience and how.
So you do that during the interview by sort of directing it in that direction.
By asking particular questions about the experience.
Actually, yeah.
And that is very different from many qualitative interviews.
Right. This brings me to the next point, that the time course, the time dynamics. Because also what I found, what often is missing is, you already mentioned it a bit, but I'm again going to start with an example and then give you a little bit of background, because things like this can happen. For example, I shrunk smaller and smaller and smaller until all that was left was this little seed, like the nucleus of who I am as a person. And then that has appeared, and I died completely. Not a feeling of seeing myself die or an out-of-body experience. I died, and I became dirt. And I felt what it was like to be dirt, and slowly grew into a sapling about 6 feet tall. So I felt like it was like to be in different seasons: spring, growing and winter. And as I was a tree, I watched myself, my human self. You see, what often seems to be, for example, scholars like William Richards, but also Stanislav Grof, made the point that often before you have anything like a mystical experience, there's some kind of destruction, renewal kind of vision. So, for example, here, this was a patient suffering from compulsive obsessive disorder, getting a moderate dose of psilocybin. He had a kind of convincing dying experience, and then he was symbolically reborn as a tree, basically. And if you hear this, you could listen to this if you haven't heard it. It's on Netflix, How to Change Your Mind Part 2. And you hear all this emotion, his close to tear voice, it just means so much to him that it's kind of amazing. So, and William Richards, as a scholar, had said before, people sometimes can enter the transpersonal or mystical realm, they often have 3 types of visions. One of them is a convincing sort of dying experience and then reborn. Another, a very convincing fear that you are going insane. They just gave you too much psychedelics, that's it. I'm never going to be sane again. Or it's just a feeling of total disintegration. And usually then it's the therapist's role, to interpersonal grounding, hold a hand or so, say, go for it, die, or do go crazy. And then they kind of can break through. And so one question would be, do you observe that too? And the other thing that strikes me is, for some people, they seem to have to go to some kind of destruction, renewal vision, also like this gentleman here, and other people don't. They sort of seem to go directly to the mystical bliss without having to bother to go through this destruction, renewal process. Maybe some thoughts on this?
There was a tree involved, so maybe you're plant spirits. Such a complex topic. I need to reflect on it first.
I can speak to it to start. In terms of this particular example with the death rebirth process, I'm glad you brought up Stan Grof's work with that, but it also makes me think of Chris Bache's work. And he's a religious emeritus now of religious studies, and did several high-dose LSD sessions and wrote about it, but talked about that those difficult circumstances before getting to that mystical place, and then he talks about the personal and transpersonal, but also the cosmic dimension of those kinds of experiences and the mystical experiences in cosmic terms as well. And I do appreciate the turning into a tree. It's mythic in a lot of ways in that particular example that you gave.
Yeah. Any more thoughts on this?
Yeah, maybe from the ayahuasca culture we know, there was Tom John Wolfe, who did also qualitative research in the Amazon, and there, like this bottleneck phenomenon, that there's an initial phase of difficult experiences, and then he called it bottleneck, and often, like in the ayahuasca cultures, also with the purging of the so, and then afterwards, so this is like a concept that's maybe evolved due to like the experience of many people, but I don't think, or I'm not sure if I would like put them like. I also know that some people have like very supportive experiences from the beginning, and sometimes I think that's valuable to kind of give a ground. I wouldn't judge it, I don't know, or compare it. It's just different dynamics.
But do you quite often observe these dramatic parts, or not so often?
It can happen. In the ayahuasca, certainly, it's often a part of what they say is the healing part. And of course, we also see that with patients, but I don't see a pattern. It's always like this, or most often like this.
Yeah. Okay.
Yes, likewise in our trials, we have several people who report this feeling of death and rebirth, or sometimes just death. And it's just, there is psychedelics touch on, there is such a huge variety of psychedelic experiences that are possible, even no matter how you standardize the dose, set and setting, there is still way more experiences that can be classified by any one metric. So if we say, okay, mystical experience is important for therapeutic outcomes, but what if amongst your study participants, not everyone gets mystical experience? Actually, maybe many people will not score full mystical experience as per the questionnaire, but their therapeutic outcomes improve and they feel better. But they feel better because they process something of personal nature. For example, what Ross was talking about. They got the sense of connectedness to, and sometimes it doesn't have to be this mystical connectedness to the world at large. It's enough for people to feel connected to their loved ones, to their children, to their family, to their friends. And that in and of itself can be incredibly healing and beneficial. We had one participant who connected to his dog that died recently and processed the grief of his dog dying. So what I would like to see is that mystical experiences are not the only construct that's correlated, or the main one that's correlated to therapeutic outcomes, because there is a variety of experience, and it's important to acknowledge that for different people, different things can be beneficial, and it doesn't have to be always trying to aspire to get to this transcendent state.
I think that's very, very, very important point.
Yeah,
and this also brings me to the, because I think we have like 4 minutes left, brings me to the last round, because I also think that somehow questionnaire-wise and so on, we all have a bit too much this focus on the mystical experience. We do have some questionnaires, for example, insight questionnaires, emotional breakthrough questionnaires, but the sort of more autobiographical experiences are not as well measured. So as a final round, you already sort of started it, Ariane. What do you think should we also focus on that maybe has not been focused on enough so far from the psychedelic, important parts of the psychedelic experience, beyond the mystical experience? Maybe Helena?
Yeah, good question. I mean, I can think of several things that people report, but we don't represent it in questionnaires. Something that is interesting to me is regressive states, which were talked and reported about a lot in the 50s, 60s, but we don't really have questionnaires focusing on early childhood experiences. As a construct or regressive states. I think you showed us a questionnaire where it has some items about that, but people...
Yeah, a few items.
People often report this, and we don't have a strong focus, or not a focus at all, at the current research.
Mainly regressions into childhood, or
I talk specifically about these regressions. Like I felt like when I was 3 years old, or I mean, you can extend into I don't know, perinatal or prenatal states. But I was now just thinking about these. I felt like a child, or I remembered when I was with my grandma, blah blah blah. So we have that all the time, but there's almost no focus in research.
Okay. And do you think it's very meaningful to participate?
I mean, our patients report that it's meaningful, yes, and we can work with it in the therapy. It's certainly one of the most, maybe something that occurs a lot and has some impact on the therapeutic process. Now I'm talking with the therapist's hat on and not with the researcher's hat on.
You too, would you like to add anything that we maybe should measure but we're not measuring yet?
Yeah, I'm intrigued with the aesthetic qualities of the experience.
Aesthetic role?
That are under-researched, that they enhance aesthetic perception, for instance artworks, but also music, but also with closed eyes, of course, the visuals. Marco Daquil and Leo Roseman have written a beautiful paper calling attention to the importance of the visual effects of psychedelics that are all-inducing and completely under-researched in terms of like the phenomenology, the complexity, what people see, but also in terms of their therapeutic potential, because it might very well be that for some people it's just a very powerful experience of feeling in awe that might be transformative. And Peter Hendricks has actually argued that the experience of awe might underlie the therapeutic efficacy of psychedelics, like being overwhelmed and seeing beauty and putting things more in perspective. So especially the aesthetic and visual qualities seem to be unexplored.
Somatic experiences as well, like both various effects that are felt in the body, but also embodied insights or embodied realizations. So sometimes people report, at least in our trials, that something that they've knew already all along, but they felt it for the first time.
In the body.
In the body.
Yeah.
And like these Kundalini experiences and so on, do you get this often?
Sometimes, yeah.
Sometimes, okay.
And I'll just quickly add as well the broadening to the ecological dimension, beyond just the personal or the transpersonal, but broadening to the more than human as well, and the land and place.
Okay, right. I think our time. Yeah. So thank you so much. Now we're going to open up for questions to anybody.
Thank you for a very fascinating panel discussion. I've seen some YouTube videos where people report having psychedelic experiences and then ending up in a psychiatric hospital, and oftentimes they will talk about these psychic experiences. So being able to hear other people's thoughts, and also there's this past life experiences, remembering other lives. Like, what do you think of these? Is this something you measure or see, or? Yeah, I'd like some thoughts. Thank you.
I can add that we used this old questionnaire from the 60s, Psychedelic Experience Questionnaire, and it has, for example, with hundreds and hundreds of research participants, and it has this item, this kind of telepathic item. I could hear other people's, I could read other people's thoughts and so on, and basically shows 0. So we could not really find any much on this. So I wonder if it maybe happens more in a recreational, less safe setting. But yeah, we gave the topic a chance, but it basically was 0.
So I realize this might be a sharp topical turn, but I wanted to ask something regarding the future of telehealth.
The what?
And I'm aware it might come off as a bit dystopian, but what does the perspective of a virtual reality, AI, psychedelic assisted therapy look like for you? If you want to speculate on that. Thank you.
Anybody in particular? Or? Anybody else?
I think online or electronic tools will or are already helpful for preparation, integration, like connecting people beyond the sessions, but I'm kind of it doesn't feel good to think of actual psychedelic experiences and telehealth combined in one. So I think there are valuable tools for the whole, the full thing, but combining the psychedelic with telehealth. I heard that there's in the States online facilitation of psychedelic, like online psychedelic sitting. I don't know how that should work, and it doesn't feel right. But maybe you have experiences other than I have.
We did a small study on an online psychedelic ceremony that was organized by a retreat center. So they had a plenary setting where the music was being played from, and people were guided through the ceremony. And there were only 5 people present or so, and that was broadcasted to approximately a couple of hundred people across the world, who filled in a survey afterwards, taking the psychedelic by themselves. And that was positively evaluated, even though people did it by themselves, but we don't have any control over whether they had prior experience, were already used to it, or were with other people doing it by themselves. So.